p.m.
Come back, and what an inspirational woman Catherine Constantinides, giving back in so many directions. Definitely an earth warrior and I should say humanitarian changer, making big differences. So maybe we should just take something like that into account and go a step at a time to make people's lives better. And talking about making people's lives better, this is where our next guest comes into play. Her name is Chantel Cooper. She's the CEO of the Red Cross Children's Hospital Trust. And she's going to be talking to us about the hospital itself. And there's some amazing things that they're doing there. And that's what we're going to tap into this afternoon. A very warm welcome to you. And thank you so much for joining us on the show this afternoon.
Oh, thank you, Nafeesa. It's absolutely fantastic to join you.
It's such an honor knowing that we can, tap into people that are making such amazing differences in other people's lives. And I think that's what it's all about. Talk to us a little bit. Firstly, a warm welcome. We're very honored to have people like you around. And the reason I said that the second time around is because I want people to understand how important it is to be able to give back and to get selfless, because that's what this is about. It's about creating that Ubuntu and building people up. Talk to us about the Children's Hospital Trust and the Red Cross War Memorial. What does it do for you? What is it that's important about the hospital reaching out to children in need?
So I think I often tell people that I'm one of the luckiest people in the world because I get to work with angels every single day. And I think the COVID pandemic was really an example of walking through the passages, seeing every single individual putting their lives on the line to save others. And I think the second part of what I do is we work with children who are sick and injured. And there's something very special about the children that come through the hospital in that they give you perspective. They give you perspective on what's important. Because, we live in a world where we're surrounded by so much negative media and we're surrounded by drama that just comes at us all the time. But children just give you that perspective in terms of what's important in life. And so the Red Cross Children's Hospital is a state facility. And it's a teaching hospital in partnership with the University of Cape Town. So it has twofold purpose in terms of it provides access to excellent healthcare for children from birth up until 14 years old. And then you have the teaching side where it even extends to bringing pediatricians from all over Africa to specialize in an element that they want to go back and save the lives of children in their countries. So it's a specialist hospital that serves South Africa, and it ranges from cardiology to renal to transplants. I mean, a couple of weeks ago, the hospital successfully underwent a surgery where a young girl had undergone a heart transplant. She's now back home and hopefully back at school. And it's the first heart transplant that was done in 11 years. So wow. It really is, and you mentioned me, but it's not about me. It's about the people in the hospital that really perform miracles every single day, and I'm just fortunate that I get to work with them.
I think that's absolutely phenomenal, to see people go out there and selflessly give back. And as we're saying, it's about changing lives for the better. And this particular hospital has been doing nothing but that. What a phenomenal success story that you just told us right now. And I think we need to, of course, commend the staff members for going that extra mile to make sure that every single day, without fail, they're getting so much of blessings for the type of work that they do.
Yes. And I think what makes this hospital, and it was the first and one of the largest standalone children's hospital in sub-Saharan Africa. So you can imagine, we're currently raising funds for our emergency center. You can imagine if you're going into a facility where there's adults in an emergency center, it's a very different environment where you don't want to expose children to what adults are going through. And so that's what makes our space so special, because it's a hospital for children. And what makes it even more special is that the hospital and the staff understand that a child doesn't come in alone. They come in with their families. So the
Mm.
support that's provided is for not only for the medical care of the child, it's for the family to ensure that they have what they need while
Mm.
their child is sick. So many of our patients come from impoverished communities. And
Mm.
so it's looking at, have you had something to eat? Or have you got something warm if it's cold? It's just looking at the whole aspect. We have an incredible group of social workers in the hospital. So if there's broader issues where if a child's being discharged and they need food for when they get home, if the child needs to
Mm.
get strong, that's what the social workers. So we arrange food parcels, we arrange snack packs while they're in hospital. So it's more
Mm.
than just the medical care, it's the holistic care. And that, it's very hard to describe it in words, but it's just the energy in the hospital is just so inspirational. And you think hospital and you put inspiration, it doesn't always align, but you truly, truly feel it when you walk in there.
Yeah,
It's not a scary place to be.
I so agree with you, Chantal. It's about, and I love the concept because the idea is that you're creating this holistic upliftment, should we say. Um, in a lot of instances, people walk into a hospital, walk back out, and that's the end of the story. That's where it stops. Having to define the need of that particular person, that child, that family, I think is absolutely amazing coming out of your system, because this is something very unique to what you do, which nobody else actually offers, is defining the needs of those people to be able to uplift them so that when they walk out from there, and as I was speaking to Catherine earlier, is about giving them that dignity that they require. And by just even giving them food, that already helps in many directions. Share about, I mean, you were speaking about the emergency center. It's an upgrade that was done recently, am I right?
No, so
Talk to me.
it's a current project.
Are you busy with it at the
Yes, we're
moment?
busy with it as we speak. Yes.
And then what is it going to offer, and what can people expect from it? And of course, how can they help out? Because as we know, things like this don't come, I mean, the cost factors don't come easy. It costs a lot to be able to also afford to be able to give out there.
Yes. So the emergency center. If you look at from the number of patients that our hospital takes care of, so on an annual basis, they have around 250,000 patient visits a year.
Mm-hmm.
And emergency center sees around 45,000 patients a year. So it can
Whoa.
range from someone who has been knocked over by a car in a car accident, or someone who has measles, or my child has a temperature. It's a range of different patients that come through the door of the emergency center. And so the problem we had with the numbers increasing, we do have a challenge with the number of patients coming through increase. The space was too small and there wasn't a good flow, and the equipment they had, we opened in 1956, have purchased along the way, but the equipment has been getting old. So they don't have, and we know with technology it changes regularly. So we needed to get them updated equipment. So we started the building at the beginning of last year, with 2 phases. We've completed phase 1. So the staff are currently operating in phase 1. And it's amazing to see the difference, just that space and light and amazing child-friendly murals makes to a space. It's not scary when you come into it. The staff are operating in an environment that they feel comfortable in. And then phase 2 will be completed in January next year, and we'll have a really good opening in February. But what we're currently fundraising for is equipment. So you
Right.
mentioned cost. So the numbers are quite scary, but our focus now is on equipment, which is we need to raise 20 million. We've raised about half of that already. And our Ramadan campaign has really been around, we need to raise 4 million Rand for specific pieces of equipment, which is incubators for your tiny babies as they come out of an ambulance or rushed in by a mom. It ranges to mobile beds, monitors for
Right.
the beds. So it's a range of pieces of equipment that we need to have so that when they open in January, they have the equipment within the beautiful space that they're operating in.
And I think that's important, because now what is happening is you're defining the other needs within the communities as such, and trying to offer those needs to them, so that at least they have a place where they have that support structure. And that's what you are, literally that support structure, giving them that hope and that faith, knowing that there's someone they can go to for help when it comes to that particular aspect. Now, as we know, incubators are very expensive. They don't they don't come very reasonably priced. So how can the community actually assist in helping you? I mean, I know you had a pledge line, and you brought out some money there, but it's about ongoing giving, because that's what it's about. At the end of the day, it is the blessed month of Ramadan, as we know. It is the month of giving back. It's the month of uplifting and reconnecting with the Almighty. And when we say reconnection, it doesn't just only mean by the form of prayer. It's by the form of uplifting people and changing their lives for the better as well. And in that way, you're getting so many more rewards as what you would have gotten before.
Yeah, yeah. And I think the important thing is that it's it's investing in children, because these children are our future. And we are on ITV again. We're doing another pledgeathon on Sunday between
Oh, okay.
10:30 and 2:30. And I think for me it's more than just raising the funds. And I think the most powerful experience for me when we had the experience on Monday night with ITV is the number of people who phoned in, who were ex-patients of the hospital, who were helped and are now adults and living their dreams and were
Wow.
wanting to give back. And these are adults that are living across the country. An important thing is the hospital is not just about Cape Town or the Western Cape. It serves the entire country. And people are phoning in and sharing, this is how the hospital changed my life. And we're talking about 1970s, 80s, 90s, and even recently. And so it's really about, and even if getting involved doesn't mean just through ITV, it's about giving us a call and saying, I want you to know how the hospital has changed my life for a better, or I remember this nurse or this doctor, because we give those stories back to the staff in the hospital to let them know the impact that
Mm.
they've had on people's lives. Because we're in the moment, and you imagine in the emergency center, your entire focus is on saving the life of the child, and then you
Mm.
don't see them again. And so
Right.
we love to hear those stories, and saying it also boosts the morale of the staff, that they too are making a difference and that they get it to hear from the lives that they've saved. So it's really about getting in touch with us, phoning in on Sunday, pledge support if you can. It's part of the bigger, building a relationship, join the Red Cross family. That's our
Most
request.
definitely. And I love the idea that you say family, because hearing just one of those success stories of yours, it goes to show that you are creating that family, because the very fact that people are appreciating what you've done for them before and having to want to come back and, of course, help you empower and uplift somebody else already says 1,000 words about the hospital and what it has been doing, not just for one person, but for families. Because I always have this idea where we look at something and say, if one person in a family is affected, it's not just that person, it's the entire family that is actually affected with whatever they're going through. So you've gone into that space and created better family environments. And I think people are starting to appreciate that fact, and wanting to give back says a lot, because it
Yes.
goes to show that they appreciate that their lives have been uplifted, and they'd like to now go and reach out to you and help you in order to be able to, of course, support others that were in situations that they found themselves in once upon a time.
Absolutely, and even though we support the hospital in terms of, I mean, we're a registered non-profit organization, and 100% of the donations that come in go to the projects. There's no administration fee that's taken off. And even though we build the buildings, or we provide training, or we purchase the equipment, the hospital is more than just a building. It's about the people inside. And that is our role and the role of our community. And that's why I say share your story, share the impact, because it's about the people inside, and sharing that they know that we appreciate everything they do, particularly during 2020 and COVID and the pandemic was a year to demonstrate how hard our health workers across all health centers work. And they
Mm.
really, truly are called to do what they do, and they are a special kind of person. And we want all health workers to know, including ours in our hospital, that we do appreciate them. And the feedback from the community is part of that appreciation.
That's so true. And it, from listening to what you're telling me, it's about creating relationships. And these relationships are ongoing relationships. They're not once-off relationships. In a lot of environments, when you walk into a hospital, you're just a patient, you walk in, you walk out, it's the end of the story. Whereas from your side, it's so amazing to listen to these phenomenal stories that you're talking about. But for me, what stood out is that you've started creating these relationships that are going to be building on forever from generation to generation, where of course then in actual fact what's going to happen is you're going to be getting that support structure that you've been looking for from generation to generation. And I think that's what it's about. It's about creating that Ubuntu that we always talk about in South Africa. And you've definitely become that spinal cord and that structure to families by just reaching out to one person in that family. You've already created a relationship with the entire family, and it's going further and further on. So I want to commend your staff and yourself on behalf of myself and the Salam Media team to say thank you so much for creating those relationships. Thank you so much for standing out there and making those differences and impacts in people's lives that we never thought would come out of a hospital. Because a lot of the times, I think we just walk in and we walk out and we say, thank you very much, that's been done. But as we can see, there's a lot more value to your hospital than just being a hospital. It's actually a home away from home.
It's exactly that. And so our role is to create that home away from home, but also to make sure that the staff feel that they're working in a home away from home, because it is, as you're saying, it's about relationships. It's a mutually beneficial relationship, and they really are. And I've said it so many times, but I'm inspired by the people I meet every single day. And it's the children heal because of the people who take care of them, and it's more than just the medical care. It's the care that they show. I mean, I mentioned another example of, I had one of the nurses who's head of one of the sides of the emergency center, the trauma side of the emergency center. There was a mom who was absolutely exhausted. She had a 1-year-old who get involved in accident. He was very energetic and he had lots of energy. She just took him from the mom, put him in the pram, and walked him around so mom could have like a 10-15 minute break. And that is essentially what we're talking about. It's more than just a patient medical care. It's looking at, it's the whole. It's the whole, because children heal quicker when they feel the care of the adults around them. And it's just something that we want, our communities to understand, is that we owe our children the safety and protection for them to grow up in. And this is just a true example of what happens in a space where children are vulnerable, children have been hurt, they've been injured, but we have adults that create a safe space for them to heal. Truly remarkable.
And it's not just a safe space, Chantel. I think it's the love and the compassion. And that also makes a major difference, because it's, when you reach out to a child with love and compassion, it's a very different scenario as opposed to just reaching out to a child to say that I need to take care of you and I need to fix you up with whatever's happened to you. It's about reaching out with that love and compassion. And that's definitely very impactful coming from your staff members, to say that they're doing this with loads of love, lots of compassion, and lots of dedication.
In working environment, and again, I mentioned the pandemic because it's had such a huge impact on our healthcare facilities, operating in an environment surrounded by the anxiety of COVID. And do I, don't I, what I do, it's until, if you can think of the environment that we're in last year, is that, how do I protect myself? How do I protect the parents? How do I protect the children? Because they are our priority. But I also need to remain healthy and safe so that I can take care of those around me. So it really, really, it's exactly what you're saying. It's love and compassion. And children children need adults, and it's not always possible because you have a lot of parents who are
Mm.
working and are not able to be by the bedside every day. And so
Mhm.
you often find the staff who need to be the stand-in parent. So if you think of a baby who's crying, it's that extra step, it's that extra love, that extra compassion that comes in when taking care of the children.
Chantel, one question. How would people be able to get into touch with you besides the pledge line to be able to support yourself and the organization to be able to go out there so that we can help make differences in the sense, through you, of course, by extending on those relationships? So, would you like to give us the contact details?
So the our WhatsApp number is easy to remember, so I'm going to give it to you. It's 071 22 44 777.
All right, there we
And
go.
then our website is also easy, children'shospitaltrust.org.za, and we're on all the social media platforms, Children's Hospital Trust.
Right.
Please get in touch, even if just to
I,
share a
I
story.
was just I was just going to say that. You took the words out of my mouth. I was going to say, please support them, support the relationship, support the upliftment, and support the love and the faith and should we say the spinal cord, because that's what you become in some way. What message would you like to leave our viewers with this afternoon?
I just, to every single person who knows us, who has supported us, we can't do what we do without you. It is about a family. It is about connecting. It is about building relationships. And giving also brings about receiving something special. So there's something very special in giving. And as you mentioned earlier, it brings rewards, it brings a sense of purpose. And I think we do have a purpose, we do have a role to take care of our children. And we need you to help us to enable the hospital to continue doing that, because it's not about now, it's about ensuring that we're able to provide support and care for thousands and thousands of children now and into the future.
I so agree. But there's something that you said that I want to read out to our viewers, which like really stood out for me. It says, if there's one lesson we have learned this past year, it is that life is fragile. And we need to work together to make a difference in the lives of the vulnerable, especially our children. And I think you couldn't have said that more aptly, especially during COVID-19. And I'm sure you're still facing a lot of those challenges and having to pull together as communities and as the public to be able to help serve and uplift, I think is the most important thing. It's our purpose in life.
And we've learned that we can't do it on our own. It is about leaning on each other and
Mm.
supporting each other. I mean, that's something very powerful that's come out of the pandemic, is that
Mm.
it's about we need each other.
No, most
And that's
definitely.
and we can rise. And I think there's something very special about South Africans too, is that we can rise above any challenge that faces us, and we're doing it, and we'll
Mm.
continue to do it. And again, it's not just for us; it's for our children, for their future too. Um,
Mm.
we have a role to play in all of that.
I so agree with you, and it's so nice to see that we as South Africans through COVID-19 have not gotten depressed and gone into a state of devastation, but everybody has tried to pull together and create these support structures and build each other up, and I think that's what it's about. We found our Ubuntu, and we're going to keep going with it, and we're hoping that our viewers that are listening out there are going to help us with that Ubuntu as far as the Red Cross Children's Hospital is concerned, to be able to just make that difference. And even if you just help one child, you've done a lot for one day. So thank you so much for joining us. It's been a true inspiration chatting to you. We're wishing you nothing but the best. You, of course, have our support as far as your hospital and the staff members are concerned. And we also want to commend you once again to have gone out selflessly, especially during the COVID-19 period, and haven't given back and still haven't stopped giving out those, should we say, selfless work that you go out and do every single day is nothing but commendable. So from myself and the Salam Media team, we want to acknowledge you for doing that.
Oh, shukran, Nafeesa. And just, I mean, thank you to you and your team, Salah Media, for giving us and other organizations an opportunity to share what we do, because it's getting the word out there, because there's so many good things that are taking place. So many people make a difference. And we need to make the public know what is happening. So thank you to you and your team too.
It's been an absolute pleasure and an honor to be able to showcase what phenomenal work that you are doing. And we wish you nothing but the best going forward. Do stay safe, take care of yourself, and we will be following your journey as we go along. Thank you so much, Chantel. You do take
Thank
care.
you and take
Goodbye.
care. Bye.
Chantel Cooper, giving us an idea of course, the Red Cross War Memorial Hospital, giving back in so many directions. And we're going to go for a quick break. Stay with us. We'll be back with Ramadan around the world.